Hey YouTube, this your girl Netta Mariethedoula. So before we talked about in part 1 the partner's role in the pregnancy journey, now let's talk about the partner's role in the birth. So in pregnancy, just to recap a little bit, if you missed the first video, we kind of talked about how important it was or is for the partner to show up, to be present, to communicate, to ask questions, and also to be there physically and emotionally. Whereas also in part 2, those factors are important as well, but then there's also a few more. So now in part 2, I'm going to discuss the partner's role in birth. Now, this is like the most exciting time. You know, everybody is anticipating the birth of the child, and rightfully so. It's a really, really great moment. You know, mom has now carried baby for however long she has had to carry, or babies for however long she has had to carry. And now it's time for D-Day, as I call it. So delivery day. What on earth does the partner do? So this is a perfect time for the partner to just reassure mom, to be there, to be a physical presence, to be emotionally, spiritually. So some moms love for a partner to calm them, to ask them, you know, how do you feel? Or, babe, it's going to be okay. We're going to get through this. Everything is going to work out. You're going to have a beautiful baby. I can't wait to see you do this. Or, you know, maybe words of support. Like, I know it's going to be a bit rough, but you got this. I'm here with you all the way. So words of affirmations are really, really powerful. And what better person for it to come from than from the partner? You know, and by partner, this can be partner as far as like your intimate partner, or it can be a partner as far as like a friend or a family member. Honestly, whoever you feel is that support person that's walking with you on your journey. Also, what the role is or can be for the partner during birth is also being there to be the communicator with the doctor. So I go over this in our prenatal sessions, and we do scenarios where if mom is in the middle of a labor wave or a contraction, then the partner knows what to discuss. We've already by then went over the birthing plan and preferences. So dad or partner feels comfortable communicating what mom's wants or will be, could be. And then also, maybe there is a time where partner doesn't necessarily know what mom wants, but understands that in the middle of a contraction or a labor wave, that mom needs to focus on that. So then they know to just ask the doctor or the midwife or whoever that comes into the room or into the home, hey, can you give her a second? She's in the middle of a wave right now. So being that person that can be that confidant for that mom, that birthing mom, is amazing. And even though it may seem like a small job, it is greatly appreciated, because at this point, mom is trying to focus and connect with herself and allow herself to work with her body to birth the baby. And I mean birth in whatever way. So no matter if you're having a vaginal birth, cesarean birth, surrogate birth, whatever, you as the partner are there to calm her, to also communicate with the different clinical staff, and then also just to be there as a physical presence, even if no words are being shared. So I hope this helps. Definitely you are on the right track. If you checked off the list that you've done part 1, you've done all those things, and now you listening to this video, you realize you've done these things as well, you're on the right track. So now look forward to the third video, which is what the partner or how the partner can support mom in postpartum. Alrighty, peace.